Hello, everyone. Thank you for joining us today for a conversation about managing your mental health, the next in our series of community conversations that matter. Earlier this year, I moderated a compassionate and informative panel discussion focused specifically on children's mental health. Today, we're taking a wider look at the topic. The Behavioral Health Services Department provides crucial resources for the Monmouth County community, and we are so appreciative of the support that all of you have provided over the years. We know the last year and a half have been difficult in many ways. Today, we'll be hearing from MMC's experts about how to navigate the changes, as well as the ways that Behavioral Health Services is here to support you. Let's kick things off by talking about first steps. Stan, there have been a lot of repercussions from what people have gone through over the last year and a half, as we know all too well, including anxiety and depression. For someone who may be experiencing these feelings for the first time, what do you suggest as a first step to dealing with them?
It's a really good question. And I would say the first thing more than anything is understand that we're all in it together. We all are experiencing anxiety, some levels of depression, sadness, loss, many different things. But the most important thing is that don't be afraid to speak up. Talk to a loved one, whether that be your spouse, significant other, mother, father, sister, brother, whoever it may be, best friend. Just talk, have that conversation, make it more normal so that you understand that we are listening. After that, I would say if it continues to be a problem for you, the best thing in the world to do is then reach out to mental health professionals. You could do that simply through Monmouth Medical Center by calling either our PES unit, Psychiatric Emergency Screening Services, or you can call our ICE program, which is our Early Intervention Support Services program. Either one of those are access to our services, and you'd be able to speak right away to a mental health professional. They'd be able to speak to you and direct you to the right place.
Stephanie, how does someone know when it's time to move from trying to cope with something on their own to seeking professional help, especially as we've been talking about, if these feelings are something a person hasn't previously experienced?
I think it requires some self-reflection on the part of the person that is deciding to get the help. I like to think of two very important questions when thinking about this, and that is, am I happy with where my life is going, and what do I want to be different? I think that these are a little bit more existential in nature, but they're really important questions because this year we've gone through so much. I also think a little bit more concretely, it's important for us to think about when we're struggling, how are we functioning? Are we having trouble at school or at work? I think a really important thing to key in on is our family relationships. Is there conflict? And also it's important for us as a community to know about the symptoms of anxiety and depression and how they might play out with children and adults. There are a ton of excellent resources online, but I would say reaching out to your local community resources is a great idea, and that's why we're here having this conversation today.
But, not everyone is comfortable talking about their feelings, and unfortunately, none of us are mind readers. So it can be so frustrating and at times very scary to not know what our loved ones are thinking and feeling during stressful times. Donna, I wanted to get your thoughts on some of the signs that people should be keeping an eye out for if they're concerned that a loved one is really having a hard time.
Thank you, Molly. It's a very good question. Despite that everyone may display different symptoms and behaviors, there are a lot of similar symptoms that people can demonstrate. Some of those are isolation or withdrawal, maybe remaining away from family, calling out of work, not doing things that a person may normally participate in. There's also changes in appetite, sleep patterns, also maybe starting substance abuse or increasing substance use that a person may already be involved with. alcohol use, marijuana use, overuse of maybe a prescribed medication. Also, poor hygiene, not taking care of themselves, neglecting their household, withdrawing from paying from their bills, and also in their behaviors, maybe an increase in agitation or defensiveness when being asked, why are you not going to work? Why are you not going to school? Those sorts of things. So those are some symptoms, and for both children and adults that might be displayed, that might be a warning sign for a loved one to focus on.
Does anyone else have anything to add about this? Because I think it's an important topic where people are worried about their loved ones and they're not sure, oh, maybe they're just having a bad day. But there could be some significant warning signs that they need to really be looking out for.
I think Donna makes a really good point about getting into the specifics about what we can be looking for if one of our family members or even ourselves are experiencing some of this. I think too, when we're looking at kids, anxiety can take the shape of separation anxiety and irritability. And depression in children can also present as irritability and can also look like be mistaken for a passive opposition or lack of motivation. So it's important, just like Stan was saying, to have these communications in our families, with our friends, our loved ones, because you never know, there could be more going on underneath the surface.
Well, for the past year and a half, people have been spending a lot of time at home, but now children are heading back to school, many of them full time, and their parents and other adults are heading back to the workplace or are adjusting to a new hybrid model. All of this can involve a lot of change, and change can be very difficult and stressful. So, Jonna, what are some practical tips that you can share with our audience, specifically about staying grounded when dealing with what sometimes feels like this ever-shifting universe?
Yeah, absolutely. This has definitely been a very stressful and challenging time for everyone in their own ways. One of the biggest tips I would definitely say is to take a break when you can. Our mental health is so important, and even sometimes just taking 10 to 15, 20 minutes a day to kind of just unwind and take some time for ourselves. It's so important. And that even includes disconnecting from social media or the news, these certain platforms that kind of can increase our anxiety, and kind of stepping away from that for a little bit. I would also suggest to definitely try keeping a routine when you can. If you're someone who enjoys to exercise, maybe making sure every day before work or every day after work or school, going for a run or working out, or trying to keep a routine with your family. Maybe that will include making sure to have family dinners together where you can interact and connect. Or if your schedules don't allow that, maybe picking one day a week where you make sure that there's family time. And maybe that means playing a board game one night or watching a movie or just going for ice cream, which can also give your children a way to connect with you and get to kind of talk about their day or vent about things going on with their friends or at school. And then that kind of leads us into staying connected in general, staying connected to our loved ones, staying connected to our friends. If you're someone who's still maybe nervous about going out, maybe FaceTiming them, or even just a simple phone call to continue to talk to someone and always have someone there, like someone to listen to us. Children thrive on socialization. So making sure that children are kind of interacting with their peers, especially with going back to school full time, can really help them feel more comfortable going back to school, getting out, getting to socialize. I would definitely say also getting outside when you can, breathing in the fresh air, letting the sun hit your face. It's so great. And kind of, when all else fails, just remember to breathe. Deep breathing is such a great thing to remember. Sometimes we don't have that time to go get to see our family or get to move away from our phones, depending on what we do for work. And just a little, even if it's once a day, remembering to take some deep breaths to help calm our anxiety if we have any, and kind of take control over ourselves and our thoughts and to calm ourselves can be so beneficial of keeping us grounded during any of those times.
Does anyone have anything else to add? Because I do think this is a very important question, because I just know personally among friends and family, people are openly talking about having more anxiety about their children going back to school full time and losing that control of them being at home and knowing that they're safe at home and now they're going back to school, or having to start to commute to the office again, or even just going out to dinner with friends. It is stressful in a new way for people. Do you have any advice about that?
Well, I think we have to be patient with ourselves. And if we can start to be patient with ourselves, we're going to be patient with everyone else. What I mean by that is, let's not be so hard on ourselves that we're going to get it right all the time. That we may say to our kids, we may say to our loved one, we may say to someone really important to us, something that we didn't mean to say. But the mere fact is that we're trying, and we're trying to communicate. We're trying to keep as open and honest as possible. At the same time, understanding, you know what? I have to be patient with me. Therefore, I'll be patient with everyone else.
Right. In times like these, we need to be patient and loving to ourselves and the people who are nearest and dearest to us, right?
Correct.
Well, I just want to take a moment to acknowledge the dedication of our panelists today. Thank you all for taking the time out of your busy schedules to share your thoughts with our community on such an important topic. My next question is for Tia, who I hear is coming straight from your shift to join us today. So thank you so much for taking time out of the very important work that you are doing for our community. Sometimes, unfortunately, people turn to external things like drugs and alcohol or gambling when they're having a tough time. But as we know, ultimately, these can do far more harm than good. So regardless of what someone may be suffering from, what are some healthy ways to help change the person's mindset in the moment until they can get further help?
Thank you, Molly. So what I tell a lot of the children here on the unit is that meditation is something that is so simple, and anyone can use it. It can be free. A lot of times, if you don't know what to do, you can go on a simple YouTube search and find meditation to do at home. There's also sleep meditation if people have difficulty falling asleep. Additionally, any workout that you can get outside. It doesn't have to be at a gym. It could be going for a walk, like someone mentioned previously. Just walking outside and releasing those endorphins really can boost someone's mood. And lastly, a lot of things that we talk about are called positive affirmations. And it's something that you can say to yourself daily. It could be as simple as, I am happy driving in my car, or I'm a unique person. It has been proven that saying simple things like this that are positive every day really boosts people's self-esteem and make them happier than they have been.
I think that can be hard for people to take a moment and acknowledge how special they are. I think we are hardest on ourselves, which makes times like these that much more difficult. The world is opening up, but families and friends all may have different ways of dealing with how they want to be out and about. That can cause a lot of FOMO, otherwise known as fear of missing out. So I'd love to get thoughts from the group about how people can safely handle the pressure to get out and do more, especially if they're not ready to do so quite yet, or may have become more introverted during the course of the pandemic.
So an example would be my kids. So if I look at my kids and they have been isolated like every other person for months, but now that we're going out, I think one of the most important things to do is to ask, for instance, our neighbors across the street. My little girl loves to play with the neighbors across the street, but we have to ask first. Make sure, are you comfortable with my girl wearing a mask or not wearing a mask? Are you going to be okay with the activities that they're doing? And I think that's where it starts. It really does start with communicating and understanding that there is no wrong answer here. That if the neighbor said, you know what, I really feel comfortable if your child was wearing a mask, then that's what we should honor.
And maybe it's about baby steps for people. that
Exactly.
this fear of missing out. It's okay if you miss one thing because you're not quite feeling up to it. Or maybe instead of going to that big party, have a smaller, more intimate get together with some close friends at first.
Yes.
Absolutely. Absolutely. And I think too, when we are feeling very anxious about change or transitional times, we can resort to black and white thinking, I really can't do this. And I would absolutely encourage people to think about the exceptions and the times where we have gotten out and we have done things, because sometimes we don't realize that we are taking these baby steps when we really truly are, and how that trip to the food store and maybe chatting with a complete stranger, how that made us feel. If it's making us feel more connected and happy, we need to take a look at that and continue to take those steps forward and process how we're feeling.
I do also think, like we were saying, some people are not ready to go out to a crowded restaurant or be around a large group of people. Fortunately, in New Jersey, we do have a lot of outdoor activities that are available. So they have state parks, we have the beach, there's kayaking, or just different activities that you can do. And I feel that a lot of people feel safer outside rather than being, in a crowded restaurant, like we said. So there are a lot of outdoor options during this nice weather as well that are available, along with Zoom, Skype. You can have weekly meetings or dates with friends that make you feel comfortable while still being safe.
Well, I think too, it's so important to talk about what services are out there for people, because when people are feeling anxious or depressed, they can feel overwhelmed and not know what is out there to help them. And that help can be different for every single person. And Monmouth Medical Center has both inpatient and outpatient services. So Stan, I think it's very important that we take a moment and have you please give us an overview of the services provided so people know what is out there for help.
Monmouth Medical Center, we have a continuum of services, as you said, both on the outpatient crisis-oriented services and inpatient basis. We also have various access points. And the primary access points that we have starts with our psychiatric emergency screening services, which it's scary when you hear that at first. But the reality of it is it's the best chance that a person would have to contact a hotline, to speak to a mental health professional. And then that call will be basically triaged and brought to the right place, whether that be our polyclinic, which is our outpatient services, whether that be our early intervention support services program. And that particular program would then meet with that patient within 24, 48 hours, sometimes even on the same day. And they would provide that psychiatric evaluation, that meeting with a counselor. We even have peer supports there so that people feel very, very comfortable. It's a drop-in center. It's short term, 30 days. And then that particular program, if the person is still in need of services, they can then be moved on to more traditional type services, such as our polyclinic, which has mental health counseling services, psychiatric services, medication monitoring. We also have an acute partial hospital program, which is over at the polyclinic, which the acute partial hospital program is up to 6 months. It's a daily program for adults 18 years and of older. It's in lieu of a person going inpatient to our inpatient hospital. But our inpatient hospital has 3 different levels of service. We have our involuntary service, which are those patients that otherwise really don't understand the severity of their psychiatric problem. And they are basically there because they don't see that, you know what, I need help. Therefore, they have to be here on an involuntary basis. Then we have, as Tia mentioned, our CCIS, which is our hospital for adolescents and children, 5 to 17. And that particular program just does remarkable work with kids and their families to just stabilize them, to get them ready to go back out into the community and to really live healthier lives. And then we have our acute adult voluntary unit, and that particular is for those people who really are in need of, just that self-care and extra psychiatric service to make sure that they are going to be safe. It's short term. We're talking probably 3 to 7 days, and then they move on into other services throughout our system.
To piggyback off of what Stan said, I think when people hear the term psychiatric emergency screening services, that's a scary thing to hear. But when you actually call and find out, myself for one, being one of the child clinicians, a lot of parents don't know when they call that I actually come out to the home. We can come out to the home and talk to the child and the family, and they don't have to come to a hospital setting. And we also have someone who does what's called preventative outreaches, who she specifically goes out to adults who, they kind of feel with the increase in anxiety, but they're too scared to come to the hospital. She can schedule with them to go to their home and sit and talk with them at their home where they're more comfortable, to see if she can help link them to services like the ICE program or the Paula Clinic, where it's just where someone can be more comfortable opening up.
Right. These clinics are safe and welcoming spaces, but to be able to stay in the safety and comfort of your home is such an amazing service for people. And I would think that they would feel more comfortable opening up in that setting as well. So that's wonderful that Monmouth Medical provides that.
Statistically, it's important to note that, especially for our PES unit, statistically, we do many, many more in-home services, outreaches, than we do anybody coming into the hospital, which I think says a lot for our team.
If I may, I do think it is just important to add to that while Jonna and Stan both said it can be scary, especially for someone dealing with this anxiety, depression, or whatever the case may be for the first time, especially people that have never experienced this. And we all have noticed over the past year and a half, some people that have never experienced it have. My biggest advice would be to people, if you were having, God forbid, chest pain or migraines that weren't going away, you would reach out to your doctor. And I think that's what we are here for too. The brain is an organ like any other. And it's really important to take care of that, because without that, you're not going to be able to take care of yourself. So, and that's what we are here for.
Stephanie, if you could take a moment and describe a little more the outpatient services that Monmouth Medical provides, I think that would be very helpful for our audience.
Absolutely. So at our outpatient behavioral health service, we offer an array of help for people experiencing all different kinds of struggles. One very important group that we offer currently is about grief and loss. We run this group in person. We just started running it in person because it was determined that it was safe for more clients to come back into the clinic. And I see this group as extremely valuable coming out of the past year. That's just one example. At the clinic, we also offer individual therapy. We assist people with medication monitoring, whether the person, decides to go on an antidepressant or a medication to assist with mood difficulties. At our acute partial hospitalization program, we run a very therapeutic day that is eclectic, and it can be fun, but it's also processing our emotions so that we can get back on our feet and live the most meaningful life possible. So some of the groups ran in that program are about emotional regulation, about addiction, interpersonal issues, women's group. So we have a lot of those meaningful groups going on at the clinic. And what we see is that people feel like this is a safe space to to talk. And we've had many successful graduates of our APH program, which we're very proud of.
Well, especially after the last year and a half of people being very isolated, I would think it's so important for them to realize that they are not alone in how they're feeling. They're not alone in these experiences. And for these groups to be able to provide that feeling of community, I would think would be very, very important.
I think it's really what speaks volumes of our behavioral health department in general is that our philosophy is to be patient-centered and to design services to meet the needs of our community. And we are doing our best to tailor all of our services to meet the needs of what people are going through right now.
But it sounds like even for people who are just struggling with anxiety, some depression, all it takes is just picking up the phone and making a call to Monmouth Medical Center. And, listening to you and hearing this full breakdown of all the different kinds of services that are at Monmouth Medical Center, it's such a reminder of what a valuable resource to our community Monmouth Medical Center is. So I really encourage people to pick up the phone and make that call because there are so many people waiting to help. I would really like to take a moment and hear from the panelists about what you each love about your job, what you look forward to every day, and what makes you feel so good about what you're doing for the community when you go home at night.
I can start.
Who wants to start?
Sorry. So one of the pieces of the early intervention support services program is that we are short term, but one of the wonderful things is that we have so many services and so much support for anyone that comes through our doors. We're very immediate and we've had so many success stories. I absolutely know going home at night that we have prevented hospitalizations and we've helped people become more stable and have given them that level of support before they go to their long-term provider.
I think what I love the most about my job is seeing the progression of when the children first come in. I do work on the Children's Crisis Intervention Service unit, and seeing the progression of them first coming in, having, extremely hard times with whatever mental issue that they are struggling with, whether it be suicidality, anxiety, and really in the short time they're here, giving them the foundation to be able to cope with stressful situations and let them know what they can do before they go into a crisis mode. We do have the children and the adults as well on the adult floor fill out a safety plan prior to their discharge so that they are able to look at it. If they feel themselves being unsafe again, they can know who to call, who to ask for help, what their coping mechanisms are that work for them.
I would say for me, I love that I get to go to the homes of the children and work with children and their families. And if it's a way to prevent the child from having to come to an emergency room, and again, meeting with them in a setting where they're more comfortable. And the amount of children that we can help stay at home and not have to come to the hospital is definitely a win in our book.
I am honored to work for Monmouth Medical Center and with a team of the most talented people that I've ever worked with in my life. That includes all our psychiatrists, our nurses, our social workers, our child family clinicians, and I can keep going on, and I don't want to miss anybody out here, but we really have put our ear down to the pavement. We've listened to our community, and we are serving our community, I think, beyond and we can do so much more. But I really am honored, and what I love most is the mere fact that we are able to do innovation within our mental health system.
What do you mean by that, Stan? What sort of innovations are coming down the pike that are exciting you right now?
So rather than working in silos, rather than just treating one specific aspect of maybe a person, we're looking at the whole person. whether that be, substance abuse, mental health, any of their medical issues, their psychosocial issues, a lot of the social determinant factors out there that really is impacting our community. And that could be anything from transportation to housing to the ability to be able to get food. We have a part of that. And we do so much to be able to help the community and help each individual, their families.
Yeah, Monmouth Medical has been on the front lines of dealing with the medical crisis of COVID, but you all are on the front lines of dealing with the mental health crisis that has been created with this pandemic as well. And you give such a valuable tools to people in the community. Previously, there has often been a stigma surrounding mental health. What would you like to say to those listening today to help bring mental health and wellness out of the shadows?
He had touched on this before, and I like to think about this in the form of a question, which is, would we ever shame a person or be down on a person who was diagnosed with a medical illness? Would we shame them for receiving medical care? And the answer to that is absolutely not. And we need to look at mental health the same way. And we need to address mental health with care and compassion and empathy, but also with access to care. So that's really important to the leadership here, that we look at the whole person, and that goes along with the stigma as well. We really strive for people to achieve their whole wellness, and that includes your mental health, your physical health, financial health, you name it. All of those dimensions of wellness wrap in for total wellness, which is what we want to help our clients achieve.
If I have a cardiac event, there's a good chance, better than not, that I've experienced some degree of, whether that be depression or anxiety. It's all connected. If I have diabetes, there's a good chance that within that diabetes, I'm going to have some degree of a mental health issue. And I think that when we talk about breaking down the silos, it's just something else that we all experience. Mental health is just that. Think about the words within itself. I don't know why we should be looking at it any differently. But I think to Stephanie's point, we have to get into the mindset that we shouldn't be ashamed. We should not be ashamed. And I think we've seen in the media, more and more that there have been people that unfortunately and fortunately, they're heroes. They've come out and they've said, you know what, I have depression. I can't function like I could. Therefore, I have to take care of myself. And I think that those things have to be put out there more and more frequent. I think that will help to break some of that stigma.
Well, I think if there's anything positive that can come out of the last year and a half that we've all experienced, is that people do feel more comfortable and more safe to come out and talk about how they're feeling, talk about any struggles that they're going through, and not to feel stigmatized about it, because everybody has difficult times in their life, and there's nothing to be ashamed about with that.
I think this is especially relevant to the essential workers, to first line responders, and to teachers and those in the helping professions as well. Oftentimes when you're in the role of a helping profession or a caretaker, you take the onus on yourself and say, no, I take care of other people. I'm not allowed to break down or feel certain emotions about anxiety or depression. But what the last year has taught us is that that is a normal reaction to an abnormal situation, right? And it needs to be normalized and, again, addressed with care and compassion. And like Stan was saying, that really starts with us having that self-compassion and recognition to do self-care, which is maybe seeking mental health treatment.
We all go through difficult things. And even in the case of we all lose someone we love, or we maybe everyone loses a job once in their life. It is okay to reach out for that specific instance and just say, I lost a loved one. I need to cope with this and I need grief counseling for X amount of time. It doesn't, need to be forever. And I think that's something that people need to know as well.
I want to thank all 5 of you for taking the time to have this community conversation. A little bit of education can go a long way, and you've given all of us a lot to think about when it comes to navigating change and taking care of ourselves and those we love. On behalf of Monmouth Medical Center, thank you to our supporters. Your donations have a direct impact on the mental health services and education we are able to offer our community. Just one example, currently MMC's Behavioral Health Garden is nearing completion. Now more than ever, we all know the importance of outdoor space and how that can affect our mental health. Building a tranquil, family-friendly outdoor space for behavioral health patients to get a breath of fresh air helps support their treatment. Today, your donations will go towards supporting mental health programs at Monmouth Medical Center, as well as helping to educate and provide outreach to the local community. You can find the mental health resources we talked about during the panel by clicking on the resources button on your screen. We are so appreciative of our sponsors who made this panel possible. If you'd like to join our family of supporters, please click on the donate button. Thanks again for joining Monmouth Medical Center Behavioral Health for this community conversation.